Hi, I'm Dennis O'Hara with the Stoneham Coalition for a Safe and Healthy Community, and thank you for joining us for today's Coalition Chat. Today, we are pleased to welcome Rebecca Lewis, who is the Substance Use Prevention Coordinator for the Drug-Free Communities Grant in Stoneham. Welcome, Becca.
Hi, thanks for having me.
Great. Thanks for being here. And so tell us a little bit about your background and what you did before you came to join us here in Stoneham.
Yeah, so I got my undergraduate degree in psychology with a minor in psychobiology. So I've always been interested in the connection between the brain and our behavior. And that kind of led me to being interested in substance use, because that is the kind of perfect combination of when the neurological pathways in your brain and your behavior are connected. So I thought that that was really interesting. So I started working in substance use treatment settings. I did that for a few years out of college. Decided to go back to school to pursue public health because I was seeing that there are so many more systemic and kind of community based reasons that we're seeing substance use. And so prevention became really interesting to me. So I am currently getting my master's in public health and have come into the prevention side of things. I think treatment gave me the perspective of seeing um, it was kind of frustrating to always be solving a problem instead of getting ahead of it. So that's kind of why I decided to go the prevention route. I mean, as they say, an ounce of prevention is worth a pound of cure. So that's kind of where I am now in trying to uh, fix problems before they start, try to empower and support the youth in our community so that hopefully down the road we're not having to spend so much energy into treatment and recovery. And those are absolutely very needed and super important work. But if in an ideal world, we don't have to do that.
Yeah. Now, I know when you're talking about prevention, a lot of people say that education is key, and it is. You need to know what's out there and what are the risks. But you sort of take it beyond that. You want to sort of give kids more choice in their activities and make those be non-related to drugs and alcohol, correct?
Right. A lot of what the research is showing now is that positive childhood experiences in any realm and in any context are that is substance use prevention. That is decreasing the risk that a child will have a substance use disorder later on. And that can be anything from the relationships with the adults in their lives to feeling like they belong in school to having activities they connect with. You might not think of those things as having anything to do with substance use, but they are all the things that in an ideal world, kids have this environment where they feel safe and nurtured, both mentally and physically. And that is substance use prevention. And that's really the perspective that I want to try to bring.
And so, talk about some of your work here in the with the Drug-Free Communities Grant here in Stoneham. What are some of your plans, your things to implement?
Yeah, so we have a couple different projects. We work closely with the Boys and Girls Club, and part of that is getting their staff to go into the high schools and offering different programs that the school staff on their own um, don't have the time or resources for, and just kind of giving kids a whole array of activities that they might be able to connect with. So that's definitely a priority. Additionally, we're really trying to build the capacity of the adults that are in the lives of these youth. We cannot expect to have uh, self-sufficient, regulated youth if the adults around them are not cared for and feel adequately equipped to handle the everyday stress of working with youth. So we're working on a lot of professional development and training opportunities to offer the adults who are interacting with youth so that everybody can have kind of a universal language and feel empowered to deal with the everyday struggles because it's not always easy being in a direct service role with youth. Our teachers um, are underpaid and overworked. And as we know, the direct care youth service industry is the same. So to really make sure that the adults are taken care of, so that way they can take care of our youth.
Well, and so talk about a little bit about what you're doing on the Stoneham Coalition side of things, because we now know your part of your role is to serve on the coalition.
Yeah, a big part of the drug-free communities initiatives are very interconnected with the goals of the coalition. So I try to bring a prevention lens to the coalition and then also utilize the different sectors that are represented there. So that way, if we're seeing a need or a gap that needs to be filled, that we can work together to make sure that the community is getting those resources from one way or another.
Mhm.
And also, I would say with things, initiatives such as Narcan and doing some like harm reduction education, things like that, it's great to be part of the coalition just to spread the word and get it out there that we do have Narcan at the health department. It is very easy to come get. You can just stop by. We have training materials and we can answer any questions you may have too. So just wanted to plug that while we're talking about it.
Great. So anyone in Stoneham can come to the health department and get Narcan to keep just in case. We hope we never have to use it, but just in case.
Yep, one of those things. It's just good to have and hope you never need it.
And so let's talk about what drives you. What sort of made you interested in helping uh, tackle the drug problem?
Like I said, I went to school for psychology, so I'm very, very interested in how human behavior and patterns make us who we are and make a community what it is. So I've always just found that super interesting. I love the science aspect of psychology. I'm a big into research and statistics and kind of naming and labeling trends that we can see in order to, you can do so much with data, but in order to drive the decisions that we're making and really making them evidence-based and data informed. So that's all very interesting to me. So I enjoy doing this work. I think of it as a science. I love science. So this is really what has motivated me to get into this.
And if someone wanted more information about the Drug Free Communities Grant or Narcan, how could they get in touch with you?
You can either stop by town hall, I'm downstairs in the health department, or email me at well, I'm guessing we can probably post my email somewhere. It's kind of long, so I won't say the whole thing right now. But community members
We'll
are
do a
welcome to
crawl.
email me at any time.
We'll have a crawl so that everyone can write down your email. So anything else you wanted to touch on today?
No, I think I just really wanted to get the message out there that substance use prevention is so much more general than people think, and that so many people are already doing it. If you are in any way making our community better, making the physical space that kids live in better, making the environmental community that they're in better, working with kids directly, or even just being a part of the community. That is substance use prevention. Those are all the things that are going to protect youth against using substances later. So that's kind of my main message I want people to know.
I love that approach. It's like it's not just, you're not just preventing substance use when you're telling kids not to do substances, but when you're just giving them alternatives and never even bringing the subject up, it's working towards their prevention. So
Exactly.
that's a great approach. Well, Becca Lewis with the Substance Use Prevention Coordinator for our Drug Free Communities Grant here in Stoneham. Thank you for joining us today, and we look forward to seeing what all you're going to do for our community.
Thank you.